My niggas, I don show again o. Dis particular video e go be on top upper limb. In dis video, we go quickly burst through the parts of the upper limb, their osteology, dats the bones wey dey contain. We go check the major nerves and the major arteries of upper limb too. So upper limb na one of the two limbs wey human being dey get. You see, we get upper limb and lower limb. Dat one wey you dey call hand normally, na im we dey call upper limb. E get parts, but like for now, make we just know sey dat one wey you dey call hand na im be upper limb. You see, dis particular structure wey we dey refer to as upper limb is unlike its counterpart, which is the lower limb. E dey kind of modified for the function of mobility, make person fit dey perform manipulative movement. Dat is, all those things wey you fit do, tailoring, sewing, all those things, na because of the kind of specialization wey upper limb get, unlike lower limb. The parts of the upper limb, the major parts wey e get, na dem be shoulder, arm, forearm and hand. Among dem, the first one, which is shoulder, e get like three parts. Dis three parts na dem be axillar, pectoral region and scapular region. Now, all dis parts one by one we go take dem. Axillar na just wetin you dey call armpit. Dat armpit wey you get, na im we dey call axillar. We get pectoral region for chest, dat your chest, na im be pectoral region. And you see scapular region, e dey back. Dat bone wey dey your back, if you touch am, around there na im scapular region dey. We go come back. The two bones wey we get for dis region, na dem be scapula and clavicle. Dis two bones, dey dey articulate with another bone, dat is, dey dey join together with another bone wey we dey call the sternum. Together, dey form wetin we dey call pectoral girdle. As you dey see for your screen, dat one na im be scapula, dat one wey dey front na im be clavicle. Together with dat sternum wey I dey show right now, together dey dey form pectoral girdle. We go explain about am later. The next aspect wey we get na im we dey call arm. So dis arm now na the region wey dey between the shoulder and the elbow. Elbow na im be the termination of arm, and the arm itself is divided into anterior and posterior compartment. E dey your screen, you dey see am. That's the anterior part, dat part wey dat swelling dey, dat one wey you dey flex up and down if you dey lift weight. Then we get the posterior one too, posterior compartment. Now, for their center, we get a bone known as humerus. Humerus is the longest bone in dis upper limb. Next up is forearm. Forearm is the region that is after the elbow. Elbow, that's from your elbow down to your wrist, where your hand begin, na im be wetin dey dey call the forearm. So dis forearm now is having an anterior and posterior compartment, just like the one wey we just treat, which is arm. So you see, forearm and arm have dis similarity of anterior and posterior compartment, and you dey see am, e dey your screen. Everything just dey anterior, posterior, shey you get. Now for the last segment, we go move go hand. Dat is the hand wey you dey call everything in the first place. Dat one, we don see sey we get arm, we get forearm. Arm being the proximal and forearm being the intermediate. And hand now, the real hand gangan, na im come be the distal. Now dis hand get different parts. We get the wrist, we get the hand proper, and then we come get the digits. So let's first take the wrist. Na dat place wey wrist suppose common since when you small na. Like, wrist na the place where you dey wear wristwatch on top sef. So dat one no need much explanation. We come get hand proper. Hand proper na the part wey you dey use tear person dirty slap. So we come finally get the digits. Among the digits, na dem we dey call fingers. But the thing come be sey no be all digits be fingers. That's another interesting fact to note. The thumb is not a finger. The thumb is the thumb, but it is a digit. Shey you get am? The bones include the carpus, which are in the wrist region, the metacarpus, which are in the hand proper, and then the phalanges, which are in the fingers and thumb. Next, we move to the nerve supply of the upper limb. The nerve supply of the upper limb is being majorly contributed by the brachial plexus. Brachial plexus gives a lot of branches which go on and supply different parts within the upper limb. Now for the arterial supply of the upper limb is all majorly coming from the axillary artery. Its branches split off to supply the different parts. For first of all, there is a transition from axillary artery to brachial artery, and then brachial artery finally divides to give the radial and ulnar arteries. Their branches supply the different parts as they move across these parts. Thanks for watching. Please remember to like and subscribe before leaving the channel. Have a nice day from Hood Anatomy.